discussing the budget. Okay, and the committee of the whole will please come back to order. With the cooperation of the administration, we're making a slight change in the schedule to ensure that the larger departments get fully discussed, and so we're going to start with DCFS, and then we're going to go on to senior and adult services, and then we're going to go back to the printed agenda. So I would like to call forward Director Patricia Rideout to present on behalf of DCFS. Welcome to the committee.
So I think everyone is aware generally of what our responsibilities are, and our short mission statement is worth remembering, which is that the purpose of the Cuyahoga County Division of Children and Family Services is to assure that children at risk of abuse or neglect are protected and nurtured within a family and with the support of the community. So we are the statutorily mandated entity that receives referrals of concern regarding child abuse and neglect, investigates those, determines whether they can be substantiated, and then provides ongoing services both to families with children in their own homes, which is our primary business, as well as services to families whose children require out-of-home placement. We work on reunification, and if that doesn't work, we work hard to find different permanent families for those kids through adoption or guardianship arrangements. We also assist young people who we have been unsuccessful in reunifying or finding a permanent family to navigate the tough waters into adulthood. We received over 37,000 hotline calls last year and investigated over 21,000 abuse and neglect complaints. We're up a little bit from those numbers this year. We served over 11,000 children last year, and we're already past that number through 3/4 of this year, so we've been busy. As of this week, we have 1,643 children in our custody, and we are serving 6,129 in their own homes. Our caseloads are a bit high, in my opinion. Our investigators are receiving 11.2 new cases every month. They are expected to make a disposition on those cases within 30 to 45 days. And our ongoing workers are carrying close to 14 family cases at any given time. We conduct our work using a strongly values-based practice model that's called Family to Family, and those core values are safety first, children grow up best in families, families need the support of the communities in which they live, and public systems like ours must form partnerships with those in the rest of the community in order to ensure that families get all of the supports that they need to be successful. There is a slide here with some of our accomplishments of the past year, and I'll just name a couple of them. It's been a busy year. We've hired a lot of workers, 111 of them, and trained them in 6 different training classes, which are 8 to 10 weeks in length. We have developed and are prepared to roll out shortly an agency-wide strategic plan. We have created a couple of new units by reorganizing ourselves. We have a new healthcare unit and a multi-system youth unit, which includes a juvenile court liaison position. And we have created a couple of new programs with providers in our community, including a partnership with Metro Health that allows for a medical home approach to health care for our kids and allows our workers to get priority treatment when they come for a pre-placement communicable disease and injury screening for kids who are heading into foster care. Those are just a few things. We have a lot of initiatives in the pipeline for next year, and I'll name just a couple of those from this slide. We have a lot of work to do to implement that strategic plan that we've recently drafted. We have sought some help from a local foundation and are very hopeful that we will be getting a planning grant to pursue workforce development and a leadership development plan within the agency. We are getting ready to do a full-scale assessment of all of our support clerical staff, which we hope will yield some new ideas for how better to deploy that staff. We are working with the Jim Casey Youth Opportunities Initiative, a national youth in transition out of foster care approach that's active in 15 other states. And we will be responding to the long-awaited functional job analysis, which is a workload study that we've been working on for quite a long time with Franklin County and our statewide organization of public children services agencies. So those are a few of our initiatives that we'll be working on as we move into next year. So you have seen many times our budget and our sources of funding at DCFS. I think you have them in front of you again, the familiar pie chart, which indicates the sources of our funds, which are primarily federal and local, with a little bit from the state, and how we spend our money as well. We are hoping for the restoration of the initial cuts that were planned as we awaited the results of the levy. Looking forward to filling staffing vacancies, which are our most critical resource. We are in the human services business, and so having people to work with families is our bread and butter, and we need them. I'm going to stop there and let you talk to me about what you'd like to.
Okay, well, in the temporary absence of the chairman, I'm going to start with the vice chairman of the Health and Human Services Committee, Ms. Yvonne Conwell. Dan's here? Okay. Dan. You're sitting back. Okay, sorry. Okay, Dan goes first.
I'll defer to the vice chair.
I got it anyway, right? Well, I just have one concern, and I've tried to look over the new add-ins, but reading the budget, it just surprises me that with the increase of the mental health waiting list, that there is a decrease in the number of children that are going to be in our care. Can you kind of let me know how that could occur?
I wish there were an easy answer. We have, of course, many families with many varieties of needs, and our primary work, as you know, is to assist parents, adults, in rehabilitating and getting healthier, and so their children, of course, show up with the impact and the scars sometimes of having parents who are struggling with their own issues. So sometimes, the children get by even if their parenting isn't as good as it should be, and the child's needs alone should not bring them into foster care. It's really how well we're doing at helping adults get healthier and become better parents. So that's not a full answer to your question, but honestly, I can't really, without a lot of studying, answer it well. It's a very good one.
I know they're on a case-by-case anyway, and
Yes.
I guess it just would help council to kind of wrap our minds around or get a clear picture. I know case-by-case kind of makes it hard, but there has to be some generalities of, it's eating at my inside, so it just doesn't add up, because we see the kids in the community, and I don't know what percentage that is in the community that doesn't have parents that are just out there, or parents, like we like to think of the traditional term of parent and what that stands for.
So if I could just say this, Councilwoman, we do use pretty structured risk and safety assessment tools, and that's what we use to determine whether the level of safety threat to a child requires them to be removed from their families. If we assess them to be in need of that, which we do with a pretty in-depth family conferencing approach and the use of trauma assessment tools and other things, we then approach the court and seek their order to remove kids. So there's a lot of steps, but I would just emphasize, as I did in my opening, that 3/4 of the children we're serving are getting services, but they're still at home. So there's a wide range of that safety threat level and of the variety of problems that could lead to what is the ultimate intervention, which is taking a child away from their family. So, you know, there's a whole lot of services in addition to those mental health services, and I will tell you, as I always do, that in this business, there is no enough. There's never enough for a child who's not doing well. So,
Could you provide us, is that allowable to provide us with the structured safety tools, the assessments that
absolutely.
that you use? And
I
I don't
can
know
do
if it's on
that.
a number scale to say, well, a child might just have mental health issues, and so they could stay at the with their family. I guess I'm interested in knowing, where is that number, or where is that identifier when they need to be pulled out of the home,
Yeah.
so to speak?
Happy to share some of that. Yep.
Thank you.
Councilman Brady, any questions?
Just one. In the last go-around 2 years ago, I'm not quite sure you were here. Just barely here. Yeah,
I was here.
you're here. Okay, I'm sorry. The council appropriated some funds. I've been trying to get a number there, but nevertheless, we appropriated some funds over and above what was proposed by the administration. And we didn't press the matter too hard because there is, we understand, the prerogative of the executive in these areas. But we were not happy or surprised, or whatever you might call it, at the end of the first year, that those funds had not been, shall we say, signed off on. And, you know, this budget process can be farcical if the decisions we make don't have any bearing on what actually occurs. And so now that we're 2 years into this, and I see that you've added some people significantly, because we were hearing through the entire 2-year period, or deducing at least, that there was a need. And so I'd like to know from someone today whether the money that we appropriated 2 years ago has been used.
If I could just, for clarification,
Go
are we
ahead.
talking about, as I recall, it was 6 specific positions for frontline workers? Is that what you're thinking about?
Yes, okay.
Okay.
And whether that's 300 and, we don't have a large staff, but we do have a staff. $372,000 for 6 social workers. So have we hired those 6 social workers?
It's a little complicated for me to know about those 6 positions within the entire range of budgeted frontline worker positions that we have. We have been working really hard to fill all of our vacancies for the past year and a half? Yeah. And I can tell you that we have not, for perhaps more than a hot minute, ever been fully staffed among our budgeted 525 or so frontline worker positions. We work very hard with our partners in human resources. The hiring process is complex, especially with the numbers we're talking about. We've made a lot of progress. Sometimes we take a couple steps back, but I can't tell you that those specific 6 were filled because we have struggled to fill our numbers as long as I've been coming here.
Okay, Mr. Chairman to Director. We're just trying to help prod things along, and I'm sure as all of us, including the administration, were new in our roles, that the administration and the council are trying to determine as we went along what the needs were and if they were being met or not. And so I know this is maybe somewhat difficult, but then I guess, it's sort of like that point at the marriage where you say if there's anybody that has anything to say or whatever that cliche is that I never really actually saw happen except in the movies. Are your needs for caseworkers, or if it's not caseworkers, please explain to me because are your needs or your staffing needs being met under the new revised version of the administration's proposal for your department?
Well, at this moment, we're down quite a few positions, but I'm very happy that the funding for those openings has been restored, and that all of those positions are, in fact, I'm assured, moving through the pipeline at this time. Councilman, to be really honest, it's not an exact science how many people you need to meet the needs of families when you don't know how many families you're going to be serving from week to week, month to month. We watch the caseloads carefully, but as I've told this group before, the duties assigned to the workers change all the time, not only because we get new requirements, from the state and federal government. We develop improved practices and ask different things of the staff, but also because every family is completely different. And a family with 1 child could end up taking you more time than a family with 4, simply because the nature of their needs. So I don't want to belabor that. It's really very difficult to say whether if we ever got every position filled, we'd be sailing along just fine. I'm a person who believes you can never be good enough. These families need help, and they need better help and more help than we will ever be able to give them. We are working very hard, though, to maximize our resources, and we've done some good things. We have repositioned some things within our agency, as I mentioned, to try to work better on multi-system youth and collaborate better with the other systems. That's really, really a high value for us. And we've created, with the staff we have, a clinical consultation unit and, a strong healthcare unit now. We really do hope that clerical assessment, which we're finally, I think, about to get started on, is going to yield some. So, I mean, there's a lot of ways to skin the cat, and we're really open to being creative.
Just finally, Mr. Chairman, for right now, I appreciate the fact that this is a moving target. You can't put an exact number on it, but now, if not with me right this minute, during this process is the time to let whoever you want to let know what your needs are, so that we can at least appropriate funds. And then we promise that we're going to have a different approach next year about tracking the spending. Mm-hmm. So what I would at least like to say, and I share your sentiments about, well, at least I'll just share my own sentiments. I never feel like I can do enough I never feel like I ever will be able to do enough, but I feel like that the harder I try, the more likely I am to do more and to learn more. And I know that's not all about money. So as we go along here and into the new year, I hope that if you find, given new information, that you have needs, that you communicate those obviously to what we now call the other side of the street, I guess, instead of the other side of the hall, but also to this council and particularly to, at least next year, to me and the Health and Human Service Committee.
Okay.
Okay. Thank you, Mr. Chairman.
Okay. Councilman Jones.
I guess council really has, or each council member has made it clear how we feel about the staffing levels. I feel it's a concern, but if the administration feels differently, tell me how many social workers were let go last year or quit or retired in total?
We have that data. I don't have it in my head. David, do you have it?
How many were hired?
We hired 111. Yes.
Over the same time period. Over the same time period of the 111 hired, how many were fired? Or
60 lost as we hired the 111.
so there was an increase.
Definitely. We're much better staffed than we were some time ago, yeah.
Okay. You mentioned one of the accomplishments was the reaffirmation of the family-to-family practice model. Can you elaborate?
Sure. So Family to Family was adopted by this agency 20 years ago. It was a national initiative having to do with helping child welfare systems dedicate themselves to doing the work differently in some of the ways I mentioned, and being very neighborhood-based, very community-based, focused on partnership with public and private partners, really engaging families in their own decision-making and managing with data. And its core principles are about family and community. And I have always said that the best thing about DCFS is that through the years and all the changes we've had and budget concerns in 20 years' time, the agency has held to that practice model. And I believe it is a major factor in good things that have happened, which include a very significant reduction in the number of families we serve by taking their children away. We are a very different agency than we've been recognized as one of the top 10 jurisdictions in the United States for our successful, safe reduction of children in out-of-home care in the last 10 years. And I believe Family to Family is one of, if not the primary reasons for that.
In 2013, you started the iPad pilot for your investigative workers. What was the cost of those, and how many were purchased, and how?
It's pretty small, 20 of them, 20 iPads. So 20 workers, investigative workers are using them. Do we know the cost? They're $500 each, so I think I can do that math.
How successful was it?
We don't know yet. We set some outcomes that we hope to see and some measures that we're tracking. They've only had them for 6 months? Yeah. 60, 90 days. Oh, not even 3 months. So we're a little early on that. But yeah, we're definitely going to be able to tell you whether they had the desired impact in productivity and satisfaction and all.
Thank you.
Sure.
Councilman Greenspan.
Great, thank you. I noticed in your budget, the one that was submitted had a reduction, and the document that we received today looks like it restores every one of those dollars. So, a couple questions. So, in your presentation, you listed your 2013 objectives, and I'm assuming you met those. Or you call, what did you?
Accomplishments?
Accomplishments.
Whoops.
So obviously they were met because those are past tense.
Yep.
The 2014 objectives that you set forward, were those compiled assuming your budget would remain the same, or did they take into account the reductions that the administration presented?
Some of them are cost neutral, but let's see.
I was more concerned with the manpower necessary to achieve those objectives.
Okay. I think the only one on this list that involves there's two, that involve additional staffing are the implementation of the transportation unit, which we're trying right now to fill the positions, 9 driver positions. I've talked to you about that before, restoring a unit we used to have that was a lot larger. So those were approved, budgeted, et cetera, this year, and we're now finally hiring for them. The other one is the investigative consultant unit. Those are the retired detectives that we have been trying to bring on to act as consultants to our investigators. Contract retired detectives. We haven't gotten that off the ground yet, but again, it's been budgeted for, and that will involve, again, how many? 8 contractors and a supervisor.
And in that, the transportation unit, is this the 1.6 that's currently not in the budget? Did that include vehicles, maintenance, fuel, all those costs?
No.
But the operations of those vehicles are currently included in the existing budget, in the remaining
Yes.
budget?
We
Should say
continue to use all those vehicles without running a transportation unit for other purposes.
Okay. In the line, on the restoration line, it talks about restoring funding for various personnel vacancies for social service aides and administrative support. So these are not frontline folks.
No, I think that included frontline folks as well. And the aides are the drivers. Thanks. The aides are those transportation drivers, yeah.
Okay.
We didn't cut, no frontline? No frontline. Okay, thank you.
And how many, the 1.6 million, how many people, these are all personnel costs then, correct?
In the 1.6, yes.
Or is it personnel plus office appropriations, computer hardware?
No,
personnel?
they're just personnel.
So how many people is that?
I don't have that number. 40 total. 40,
okay. And the restoration would take you back to your last year appropriation with no increase? And you feel you would be able to meet your objectives with those 40 positions fully appropriated?
I think we would meet our minimum standards.
All right, thank you.
Anything else? Thank you very much.
Thank you.
And next we have Ms. Tracy Mason for Senior and Adult Services. Welcome to the committee.
Good afternoon.
Good afternoon.
Well, perfect. That was easy. I think you all have one of the printouts for the Division of Senior and Adult Services. Perfect. So I just want to give a brief overview of some of the programs and services that we have at DSAS. We are mandated to provide adult protective services where we investigate allegations of neglect, abuse, self-neglect, and financial exploitation. We also provide home support services for clients who have a high need. We have about a dozen nurses and roughly around 60 home health aides on staff that go out in the community and provide personal care. Options for Elders is a program where we coordinate services for seniors who are not eligible for passport or Medicaid reimbursement. And information and outreach, clearly what the unit title is really what we do. We go out in the community and we link seniors to various social service benefits that they may be eligible for but unaware of. Our professional development unit, we provide training to staff as well as community partners on age-specific topics. And through community contracts, we fund senior centers and other senior server providers to keep seniors independent and in their home. We also fund adult guardianship services. And all of our programs are for individuals 60 and over and disabled adults 18 to 59. We want to give you some statistical data. In 2012, we served roughly 26,000 individuals, which is 12% increase from prior year. Our call volume has also significantly increased. And we also are gathering data from United Way in terms of the number of referrals that come to senior and adult services. Through community contracts, we have provided 93,000 transportation, which is one rise, one way, whether it's to a senior center or even a medical appointment. We also have provided year-to-date 71,000 meals, which includes home-delivered meals, where we provide meals to the client's home, and congregate meals is where seniors receive a meal actually in the senior center. Some of our accomplishments for 2013. In 2004 was when our last strategic plan was created, which was almost 10 years ago. So we have contracted with Collaborative Research to work with us to create a 3 to 5 year strategic plan. At this point, we have conducted over a dozen focus groups. We have completed more than 30 interviews, as well as received roughly around 50 online surveys. So we're taking that data to identify goals and objectives for our upcoming year for 2014. And you'll hear more about the results of our strategic plan. We have also developed and implemented a centralized intake system. And in prior years, we have, for each program that I just referred to you, reviewed with you, each program had a separate intake line. And so we wanted to make sure we were customer friendly for individuals who needed to reach out to us and not try and have to figure out what number to call. So we consolidated our efforts. So our new slogan is "One Call Does It All." We have also released the RFP for a case management system, and we are so excited about this opportunity. Each program have multiple standalone systems that are not integrated, which makes it difficult with data collection, and not to mention the challenges that presents in terms of coordination of care. We have also established a performance management unit, which oversees and manages our data, customer service, as well as quality assurance processes. We had our first elder abuse awareness campaign, which we were real excited about, and I think all of you also received some information about elder abuse. And just roughly a month ago, we had our 19th annual conference on aging in partnership with Metro Health System, where there was more than 250 professionals who attended. And this year, we also partnered with National Senior Games to not only to promote the event to senior centers, but also we wanted to be really involved in the planning process. We also linked information regarding National Senior Games to our very own website. And out of that, we were also interviewed by Channel 5, which we were really excited about. Well, that concludes my presentation, so I am open for your questions and comments.
Questions for senior and adult services? Okay. Councilman Brady, followed by Conwell and Greenspan.
Thank you, Mr. Chairman. Earlier today, a lot earlier today, we had someone come in and speak under, the opportunity to address the council. Don't remember the lady's name, but I'm sure we have it.
Ms. Wheeland.
Ms. Wheeland, yes.
Lynn Wheeland.
Ms. Wheeland, who I remember a little bit as being active down in the State House lobbying on these issues. And she seems to have a strong opinion that that compared to other areas that resources aren't being sufficiently devoted to adult and senior citizens. I'd just like to, I guess, know what your reaction, to that is.
Well, I definitely agree. Division of Senior and Adult Services, we are one of 2 major funders for senior programs. And I think with that alone says quite a bit.
Okay, well, I've been getting, over the short period of time that I've served in the county council, a disproportionate number of calls, not complaining about what you do, but asking really just sort of calls for help, and particularly around the community centers. And seems to be, at least from the calls I'm getting, and given how big this county is and how big the district is, I tend to notice when I get calls about some things more than others. Do we have serious issues with our ability to provide transportation, our ability to provide staffing, our ability to provide resources, meals to these senior centers? And if we do, can you help me understand that? Or if we don't, can you help me understand that?
We do our best with what we have. Our budget for community contracts is roughly around $2.1 million, and with that, we contract with the various senior centers to provide services within their own community. And oftentimes that includes funding for a meal for that day, or just for the senior to spend their time within that senior center to provide some support for those centers to underwrite their costs. I would assume that our funding is not enough funding for many of these centers. And I believe they do what they can with what they have, and as do we. We currently have a short waiting list for home delivered meals through our options program. And as those clients rotate off the program, we are able to increase our capacity by adding those clients who are on a waiting list. The demand has continued to increase. Through our strategic planning process, we have heard clearly from various partners as well as clients themselves their concerns with transportation. So we know that there is a systematic issue as it relates to transportation for seniors.
Okay, Mr. Chairman, I guess everyone knows that as a county we have a disproportionate number of seniors in the county, and some of our districts that's more that's more the case than in others, I'm sure, but it's not something that's uncommon. When we go through a whole day of Health and Human Services, I mean, it's really, a difficult thing, because we're talking about some of the toughest issues that face our community, and as the day wears on, it's you begin to it all seems so unbearable that you almost want to there's part of you that sort of wants to throw your hands up, because we're hearing it all and hearing all of this in one day, and it's a difficult thing to absorb all in one day. But I just want to say that older people on fixed incomes, you know all this, but most people know all this, but older people on fixed incomes, isolated in their homes, some of them without adequate nutrition, are sort of invisible, compared to a lot of interesting, splashy things that our community provides, and our focus on youth culture and amenities for youth culture, and I'm all for that. Can't quite take advantage of it as I could have maybe 40 years ago, but there are, people we all know who are advanced in years, who are without resources, and I'm not sure that Ms. Whelan may be aside, that we're focused enough on that. And I know it's not all a matter of dollars and cents, but I want to try to provide more, and if this budget is not adequate, I want to know that. I guess no budget is ever adequate. Is what we always hear and what we actually know, but I don't want that to be an excuse for not trying, because there's always going to be more of a need than we can fill. So in this area, I want to see what we can do in this biennium budget to do better, and then work harder, going forward, to make sure we understand, why I'm getting calls about this. Because when I get calls, which county councilmen don't get calls like city councilmen do, when I get calls like this, why there's a disproportionate number of them. Maybe it's because I have a disproportionate number of seniors in my district compared to other districts. Maybe it's as simple as that. But I'm concerned about the resources that we're putting into this area, and not satisfied. So.
Okay, thank you. And Ms. Conwell?
Thank you, Chair. To the Director, I think you stated earlier phone calls increased. And what is the nature of the needs of these calls convey?
It is across the board. We have seen an increase in in clients needing utility assistance, as well as food requests, just meeting some basic needs of rental support, trying to be sure that a senior is not evicted. We have received calls regarding seniors. Bed bugs have been a really big issue for us that we've been struggling with. And so those are just some examples that some of the calls that we received.
I don't know how my colleagues feel, but in my recommendations, I'm definitely gonna ask that there's some bed bug assistance. I don't know if that would go to Board of Health or to you. So I'm on your side as far as that issue. And talking about the age, what is the age for a person to be eligible for DSAS services? What's the age limit?
It is 60 and over. However, if you're 18 to 59, you're disabled, you are eligible for some of our services.
Okay, and that 60-year-old age, is that a federal standard?
I believe so.
Okay, because I'm getting at the resources that are available for seniors across the county, whether it's for housing or whatever, is disproportionate. Some are 50, some are 55. So I think we really need to work toward getting a standard age across the board. What recommends as a senior, especially so I'll know.
With our other partner agency that we work very close with, which is Western Reserve Agency on Aging, they also start at 60.
Okay. But with CMHA,
Yeah.
It depends. So is there any movement toward that as far as getting an age?
I definitely think it's worth exploring discussion.
Okay.
And just also to add, for National Senior Games, you had to be 50.
Right. I don't know if that would produce some reductions or something like that, but I think it would. In 2015, and I'm going from the budget book now, are the plans under the new recommended budget that we were given today include not eliminating the 2 additional positions in 2015 that were listed in as a targeted budget reduction? Because I'm seeing the number go up, but it's not only for personnel, it was also for reducing commodities, client services, and other operating budgets. So I just wanted to know, since the budget is being restored, it does not specify if that would include the 2 additional positions that you were planning on eliminating. So I don't know if
So-
Merriman could answer that, or if you could answer that.
To the councilman through the chair, all proposed reductions to the Division of Senior and Adult Services have been restored.
Okay, so that includes the elimination of the 2 additional positions for outreach and, okay.
Yes.
The elimination of the elimination, yes.
Just want to make sure. Back to the director, if a senior is expected, because I just want to understand the process, if a senior is expected that they were abused, what is if you have a rough estimate per person if they had to go to court for legal representation? So I'm assuming that someone calls you and says, reports that a senior has been neglected or is being neglected. What is the step where the courts get involved?
I'm trying to remember our flow chart and how that process is outlined. In the event that a senior decline services, but we believe they have the mental capacity to decline, then we will close the case. But in the event that a senior declines services, but we're questioning whether or not they have the mental capacity to actually deny services based on risk assessments, that is the point when we get probate court involved to issue a protective order, so we can then have a further assessment to make a decision whether or not if we need to identify a risk plan, if we need to appoint guardianship. So a number of things could take place once we get probate court involved.
So when probate court gets involved, that's a cost that they charge you, probate court? I'm just trying to understand how the budget goes. So they do that free?
That
It's
is
a free
part of our
service.
partnership with probate court.
Okay. And you might not can't answer this right now, but if you could send us, if you have the information, how many cases this year needed some legal representation? Or, if you could send that to us. Check off my questions. And I'm going to ask you this question, but I'm also going to ask Director Rick Warner. The centralized intake that you mentioned, is it possible to have one centralized intake unit for all of HHS? Is that something that you see would be a problem if we had one general centralized intake for DCFS, Employment and Family Services? That's where I could see that we would save some efficiencies instead of each one having their own unique. And I don't know if that's. I think Sharon kind of pushes into that collaboration type model. That would save money.
Consolidation.
Consolidation. There you go. I was going to ask you when you came up, Rick.
Oh, okay, all right, go ahead.
That'll be your question too. Right.
I would think it would pose as challenges in doing so. We do work close with Children and Family Services intake staff. For example, at the end of the day, when our intake line is closed because staff have gone for the end of the day, we do roll over our calls to Children and Family Services. So we do work close with them in terms of providing those off hours coverage. And in the event that they do receive a call that that there may be some risk involved in terms of abuse, we do have a supervisor who is on call 24/7.
Well,
So there is some coordination that exists. So we are I believe we're being better partners.
Because in the world of Pleasantville, I can just view us in the new building with the one floor centralized intake for all of us saving money. So I think that's what this council is moving toward.
Good place to be.
Yes. So that ends my questions for the director. Thank you very much.
Councilman Greenspan.
Great, thank you. I'm looking at the budget variance here. So it looks like from 2013 to 2014 that there was a scheduled increase of about $2 million. I'm trying to follow this, and then it looks like there was a reduction of 308 through the cuts. Is that how I'm reading that? So if the projection for 2013 was 12,130,000, I'm looking at the HHS left, 12,133,000. Base budget for 14 is 14,148, about a $2 million increase.
I'm not sure if I have what you're looking at. Okay.
Councilman Greenspan, you're looking at the levy subsidy line. That's not the operating budget. So that increase reflects a decrease in their reimbursement revenue. So remember, we talk about human services. If there's less revenue from state and federal sources, that levy subsidy picks up the difference. Okay. Their actual base is lower from 13 to 14, though, for their total operating budget.
All right, great, thank you. And let me just ask then the real quick question here. Of the 308 that is requested to be restored, somewhat of the same questions that I asked before. Are those necessary for you to achieve your objectives in 2013 or 2014? Or if you didn't have them, would you still be able to reach your objectives? Or do you need more to reach your objective?
Well, that's a conversation that I will be having with Rick Warner and David Merriman in terms of what are some of the resources that will be needed to accomplish the goals and objectives outlined in our strategic plan. So it is not reflected in the numbers that you have in front of you.
So you're implying or stating directly that you would anticipate coming back to us next year asking for more money?
Perhaps.
Well, I just get really challenged with that statement, not only from you, but from other folks. It's been 2 years in the making to prepare. I'm not directing this at you. I'm just looking at you, speaking through you. Budget's 2 years effectively in the making, and to hear you're not the only one, that we're going to become, people are coming back to us early part of next year asking for more money. It's almost unacceptable. It's not your fault. I'm just making a general commentary. It's frustrating because we're passing a balanced budget with the expressions and statements and information presented before us today, and we're being told that yes, it's balanced today, but it might not be balanced in Q1 or whenever these other items come back before us. So just making a general statement, it's something we need to be on the lookout for in 2014. All right, no further comment.
To the chairman, Councilman, can I address that?
Yes, you may.
I do want to just acknowledge that the administration is in the habit of coming to council on an ongoing basis to respond to needs as they exist in the community. I think it's clearly understood that the budget that we have presented is a response to the issues which we know exist, but can't anticipate all future opportunities. And so as we have with this council in the past, and as we hope to in the future, I think we work well on bringing up new opportunities for the county to invest dollars. I think Administrator Mason has been very responsible in not asking for anything until she completely understands the recommendations of her strategic planning process. And I salute her for going through a strategic planning process. I've heard some of the early findings. I think it's a very effective process. And I think when we explore it with council, there will be, I think, a lot of excitement. And I hope that we can continue to work together to address the needs of this population.
And Mr. Chair, if I can, I understand that. And I understand the fluidity of budgets and understanding the operational challenges that sometimes we can't identify today but present themselves in the future. But the future to me is more than 60 to 90 days from today. If there's an expectation today or a knowledge base that there will or possibly will be an additional request for funding, within the first 90 days is almost, in my opinion, and from my professional experience, a budget miss, whether intentional or unintentional. 60 days or 90 days and beyond, obviously, we are addressing challenges that are presented before us. So that's where the foundation for my statements come from. If we have an inkling today of projected increase in expenditures due to discussions regarding programming, and we don't include them today, when we know that there's an opportunity to, that's where I have the challenge. But understand, 6 months from now, there are things that will be presented that weren't known today. But if they're known today, we should contemplate them if it's going to be part of the operational plan.
And if I could just briefly respond, I think I would like to do honor to Tracy's community process. She's engaged a lot of community members, and I know that she wants to see that process through. And the impacts that she presents and that we'll discuss with council will see us through not 60 or 90 days, but probably 60 months or something. These are strategic opportunities. Thank you.
Okay.
I would just like to add that our strategic plan is a 3 to 5 year plan, and I think we have been extremely creative with the resources that we have, and we will continue to be creative with the resources that we have to begin to implement some of the goals and strategies that's outlined in the strategic plan.
Councilman Germana.
Thank you, Mr. Chairman. We often get confused, or at least I get confused, because people come to us and talk about how things have been cut. But there's so many different places of funding, and in particular, when we're talking seniors now, federal cuts and state cuts have been dramatic. And it's not necessarily the county that's been cutting these programs, but certainly Cuyahoga County can't make up for what the federal government's doing to us and the state government. I mean, our local governments have been devastated by these cuts. In particular, I had well, it's always good to get feedback, an opportunity at a recent Chamber of Commerce lunch talking about the senior citizens resource centers. I don't know if it's a one center or if it's a series of centers that have been cut. Are any of these cuts coming from the county, or is it strictly from the federal and state? And if you could
Well, Senior Citizens Resource is a independent nonprofit organization, and yes, we are one of their funders, and we have not decreased their funding. As you only imagine, that many nonprofits struggle with being able to generate enough resources to meet their bottom line. So I think they have a number of contributing factors that is impacting their ability to provide services.
I know from, of course, being from Parma, we have a large senior program, and the cuts there have been probably larger than a lot of the other programs around. And we've got us baby boomers that are aging, so the senior. Well, let's face it. This is going to be one of the fastest growing. The seniors are growing faster than the children are, and I know a lot of the programs at the senior centers are aimed at older seniors because seniors are living longer. So I want to support senior programs as best we can within the budget, knowing fully that we can't, I don't want to say bring anything close to equaling what was cut from the federal government and the state, but So that's my comment.
Anything else? Okay, thank you very much.
Thank you.
Next, we have the Office of HHS, Director Rick Warner.
I have a PowerPoint. Good afternoon, members of the Committee of the Whole. Mr. Chairman, thank you very much for the opportunity to make a quick presentation and then get to your questions. I might first, though, begin because the question was asked by Councilwoman Conwell about the issue of like a centralized call system. So I think it's a very fair question, and I think it goes to a broader point that I believe numbers of council folks have had questions or comments about today, which is the coordination of services, the knitting together of all the services that we have. That exists obviously not only within the County Department of Health and Human Services, but also with our partners at the Adams Board, Metro Health, Juvenile Court. So I do think those are issues that we're going to need very much to work on. I think we've done a lot of coordination and collaboration. I think the issues that Director Terry Allen from the Board of Health raised this morning about the challenge that sometimes what tends to put us into various silos or balkanizes us a bit is the way our funding comes down and the way that we're required to deliver services. But that doesn't excuse us from the obligation and I think the responsibility to try to figure out ways to knit things together. So I want to just, because that question was left unanswered by me during Tracy's presentation, I just wanted to say that quickly. You have in front of you just a two-page summary of some of the issues that the Office of Health and Human Services, or what's now called under the ordinance, the Office of the Director, has worked on in 2013. I must preface my comments by saying thank you to all of you, and especially your Health and Human Service leadership for your assistance and hard work and plain old discipline on passing the Health and Human Service Levy. And the same goes for the county executive and his role and his staff on making sure that we could again tell the community about what we do, why we do it, for whom we do it. And I think the community again showed their support for the work that the county does in partnership with many other organizations by passing issue 1. And it obviously gives you all the opportunity in conjunction with the county executive to make decisions about new investments, which in a time of challenge from a budget perspective are very good. So thank you very much for your leadership in carrying us over the finish line on the levy on that. Just a couple of things that I wanted to highlight beyond the issues that we worked on in 2013, and that's sort of what our plans are, our thoughts for working in 2014 and beyond. And I think this goes back to the issue of coordination and collaboration. There are obviously, as you've heard today, and you heard from Joe Gauntner a couple days ago, many needs in the community that the public health and human service systems are trying to address, as well as our private nonprofit partners. One of the things that the community has struggled with for a very long time is data collection, spotting trends, developing best practices, looking at evidence-based practices, and really trying to better come to a set of priorities for the community that would address those issues that all of us work on in various ways. And I think the county executive has asked us through the Western Reserve Plan to work on that kind of prioritization. I know that the council has asked our departments to do those as well. I think that kind of work, especially with the levy now behind us, and as you all know, we don't have to do a levy again now, at least knock on wood, for 3 years. And I think that 3-year window really ought to give us the opportunity to build on the work that's already been going on in many parts of our, I think you'll hear it from the remaining Health and Human Service folks you'll hear from today, that lots of us are working on ways of evaluation and tracking and looking at outcomes and making sure, using the county stat process as well as other processes, to try to really figure out what impact are we making and how do we best maximize that impact without regard for who provides the service and in some cases where that service is funded. And so I think we need to continue to work on those going forward. And again, I believe that with the reaffirmation of the community's confidence in the health and human service system writ large through the passage of the levy, we'll have a chance to continue to work on those. But I think they very much go to, I was listening carefully to Councilman Schron's issues or questions about overlap, and I do think there is a lot of that, and I think we have done a lot already to try to address some of those issues, but much more work can go towards that, and I think that is, we very much feel that responsibility going forward. A little bit more internally, some of the things that we want to work on in 2014 is you gave us the authority for a differential or a set of hiring authorities that are specific to each one of the divisions within the Health and Human Services Department. We appreciate that work. That allows individual directors within the county departments to make sure that their staffing resources line up with their needs. That's part of obviously the budget process, but it's also part of their ongoing management. And that authority that you've given them through the last ordinance that you passed in 2013, what we call the segmentation ordinance, will allow those departments to continue to work that way. It will also allow my colleagues who are part of the Division of Community Initiatives, which you're about to hear from in terms of their budget presentations, to also work on making sure that those smaller offices, who most of the time do their work through contracting with outside entities to provide the service, are as well organized as they can be, especially in terms of back office function, in terms of budget, contracting, fiscal, communications. And so we do want to look at making sure that we're maximizing our resources as best we can in those areas. Finally, I think you've heard today, or maybe two more items, you've heard today a lot about the strategic planning that's going on. And I'm sensitive to Councilman Greenspan's question about, we always have strategic plans that are going on in various parts of the human services world. How do we make sure that we know what our needs are in order to implement those? But I very much view the Office of the Director as having the responsibility, along with whether it's senior and adult services or the children and family services or reentry or early childhood or any of our other entities, to help them get their strategic plans funded, and that requires first looking at existing resources. So before we even initiate a conversation with the county executive and ultimately with council, we want to make sure that we're using our existing resources the best based on the strategic plan that we've just gone through. So my office, I think, will work very much in 2014 with the continued implementation for those organizations within human services for which there's already an existing strategic plan in place, and then also with those entities that are just finishing up their strategic plans. Finally, the other thing, and I think you heard a lot about this, obviously, from Mr. Gauntner a couple of days ago, about the impact of state decisions, both the ABODS food stamp issue as well as Medicaid expansion, and frankly, the opportunities that come with the Affordable Care Act. All those are going to put great strain on various parts of the human services organization, especially Joe Gauntner's organization. And I'm grateful to the county executive for increasing the staff for Mr. Gauntner in order to be able to meet those challenges. But we have to look at the overall impact on the community. There's many other organizations throughout the community that are going to be impacted by Medicaid expansion, especially, as well as ultimately the implementation of the Affordable Care Act. And so I think it's the responsibility of my office to continue to work with not only all of you, but with the county executive's office and our partners throughout the community, especially Metro Health and the Adams Board, to make sure that those programs and those needs are being met as best they can. The one other thing that I just wanted to say about my budget specifically, and I think you have the elements of it in front of you, with the restoration that the county executive is recommending, the cut that we were proposing to the Northeastern Ohio Poison Control Center, we can restore, as well as our full support, or our portion of the support, for the work that goes on by the medical examiner's office in the child fatality review. So in my estimation, we're back to essentially full strength for my office in order to be able to undertake its responsibilities in 2014 and 15. And with that, I'd be happy to answer any questions that you have.
Questions for the director? Councilman Brady.
Thank you, Mr. Chairman. As usual, since we sort of constantly are asking questions in committee and anywhere else we catch you, I'd just like to say, first of all, it's been a great pleasure working with you for almost 3 years now. You and everybody else, but I'm talking to you right now.
Why do I feel like this is my last time in front of you? But no, I'm just joking.
Well, you know, you never know.
Thank you,
We
Mr.
have to
Chairman.
run for reelection, you know. Some of us, yeah. Some of us already have. You know, I do feel like, you know, the whole sort of thrust of, and not that all this is like, you know, the whole thrust of the new county government in some ways was to kind of break down the silos and kind of balkanized, you know, way that we function in the county. The overly politicized nature of county government, almost to absurdity, you know, really. I mean, when you go to a festival and there's like 10 different departments or 10 different public officials with their booths and their banners, and, you know, at 27 different, you know, festivals a month or something, it really gets to be quite a circus. So we've made a lot of progress, but this being a really big area, and, you know, trying to see what we can do now to move toward not being a circus inside of the new system, and leaning, you know, in the direction that Councilman Schron has continually brought to our attention. You know, I know that inside of a budget process, although budget processes, no matter how much we try, always seem to be part of a discussion about where we're going forward in the future, because we're in the whole. We're a committee of the whole, instead of in our own little balkanized committees where we don't sometimes know what's going on in the other committee very well until it gets in front of us. You know, we really need to find a way to work next year. Is all I can count on, you know, God willing, to, you know, between Health and Human Services, these different aspects of Health and Human Services, the homeless organizations and our homeless centers and the adult protective services, and I could go on, but, you know, let's just say let's take the you know, the larger animals in the room, the Adams Board and Metro and all these areas where we know we all have a similar mission, and there is a sense that we should be able to find a way that we're not that good people don't find themselves competing with each other over resources to the point of even being, you know, I think unintentionally polarized from each other in the attempt to do their job while they're competing with other people that are attempting to do their job. And we've really got to find a way to identify, you know, our overall goals, and not be parochial about whose job it is and whose job it isn't, and because we do have and we always will have limited resources, and we're trying to find the best use of them. It's because anytime, I mean, we have needs, and it's not hard to explain those needs. It's difficult to do something about a lot of them, but to choose between them, it's like choosing between children. It's not possible. And yet we have to do it. An impossible position to be in. And so, like children, I mean, we need a way to pull all this together. And I don't know how that is done, but I know pretty much know who the people are now, who need to be in the room. And I think that, you know, a really honest conversations that. We kind of break through. You know, we've all had to get to know each other. We're all from different, you know, parts of this county. We all have different ideas. We're still working on it. But you know, I mean, I'd like to see a lot more effort made in the Health and Human Service Committee and everywhere else, but to bring these people together, so that I would hope that, when we're perhaps when we are in budget hearings 2 years from now, or whoever's in budget hearings 2 years from now, that we're a lot closer to that place where, Mr. Denican comes forward, Mr. Boutros comes forward, the administration comes forward, and I don't feel like it's coordinated as well as it should be. I know this is not something easy to do. Different institutions, it's not an easy thing to do. But we have to do that ourselves. The council, has to do that as well. But you and your colleagues have done a great job. It was great working with you on the recent effort, and I know that you've been doing this for many years and been dedicated to this for many years. And I don't know how many levies this makes, but I think you've been at it for at least a decade on the levies.
A lot.
And so it must be quite a roller coaster, that I have a much better sense of now. And so I'm not here to ask a specific question because I'm just going to continue to do that. But I do feel this sense of that there's a disconnect between a lot of people trying to do a lot of good things and an ability to put together a budget that does that in a way that makes sense.
Mr. Chairman, to the councilman, if I just might respond to use Councilwoman Conwell's allusion to Pleasantville. I do think a lot of work has gone on, especially in the last 2 or 3 years, to try to meld together and to break down those barriers. I think it's been very helpful to have the county executive take the interest that he has in the work that we do, and obviously council too. And I think, frankly, what happened oftentimes towards the end of the old government regime at the county, and I'm not talking about all of the bad stuff that happened, but it just, to some degree, the elected officials ceded a lot of responsibility to folks in staff positions. And I think there were a lot of good people in staff positions doing that work. The excitement that I think we've got now is we have a set of elected officials on the administration and the council side who are very interested in the work that we're doing. And you all have taken the time to get to know these systems through the budget process and through other processes. You don't know necessarily, and you don't need to know, and you probably don't want to know in most cases all the details. But you've taken enough of an interest to sort of spur us on to make sure that we're looking for ways to provide these services more efficiently and more effectively. The other thing that I think that kind of attention does is it makes us all realize that we're going to be accountable to all of you and to the county executive for those kinds of things that we come up with. And I think a little bit of competition is a good thing. I mean, hearing Bill Denahan's presentation this morning and seeing the fairly extensive list of projects that he wants to work on, I mean, it's exciting to see there's a lot of overlap with what we do. I think there's a reason why 2/3 of his funding goes to adults and 1/3 of his funding goes to kids. That's because a lot of other funding through the county, it goes to through DCFS, through early childhood, through the Family and Children First Council, goes to serving children. And so we need to make sure we knit all those things together in a much more expansive way. But let me go back to your initial comments. I very much appreciate the confidence that all of you in the county executive have shown in the human services system, because although it's old and creaky and occasionally has its more than its probably share of moments, I think there's a lot of very dedicated people, not only at the leadership level, but more importantly and much more broadly at the service delivery, both within the county and within our partners in the community, who really make the work done. And they're the ones that we should be asking the question about how to better coordinate all of this, because they're the ones who see their families or their individuals or their seniors, dealing with sometimes with bureaucracies that don't play together very well. And I think we still need very much to work on those issues. So I appreciate your continuing interest and support for that work.
Following on your comments, and Councilman Brady and Councilman Schwan, I think it might be time to pick up what came out of the transition advisory recommendations and have a system-wide planning process for HHS and even beyond our own HHS to extend to to all the various partners out there in the community that are working on these various issues and particularly focusing on how we can reduce duplication and get better coordination. So I think it's time to really start thinking about that. And we have Ms. Conwell followed by Sean.
Thank you, Chair. To the Director, just looking at the, in the budget book, there was, before the recommended budget change, there was a reduction in capital outlay. What qualifies as the capital outlay? It was just 14,455, but I saw that across the board, some reductions or in some areas, increases in capital outlay. Under yours, what did that entail?
Well, it's not a new conference table, I know that. I may look to either Janet Carr from my office or Matt Rubino, who probably.
Oh, and a friend.
Councilwoman, that would have been for routine purchases of furniture. We've, actually, the last iteration of budget development, we've removed that automatic allocation for capital when it comes to like desks and other furniture. And then for larger agencies like DCFS, for example, we put some back in and restore it, because a larger agency will probably have more ongoing purchases for something like a file cabinet or a desk. Smaller agencies, not so much. So that's why.
So are they moving to the new building with us? So
Well, I
is
don't
this
know.
their kind of like
Are
their
you going to the new building?
charge for furniture?
Mr. Chairman, to Councilwoman Kamala, I don't think I haven't had the final sets of conversations with Ms. Tewan, but I don't believe that, as I know it, as I understand it today, that we're in the new building. Right now, 4 of the 5 offices essentially that make up the Office of Community Initiatives are together on the 5th floor of the Courthouse Square building. That actually works we all work fairly closely together. That's probably a good. You
don't want to be with us.
That's well, no,
Okay.
You're right across the street now from us, and we're in the same building now as the county executive. So, but I do think it, having us close to each other. I mean, the one outlier is the Family and Children First Council, which has its own building, and is going to need to move out of it soon. I don't know that we're going to be able to get them together with us from a location perspective. But there's an advantage to us for that.
And to the Director, IT personnel vacancies, how many staff are needed? Because I'm looking at the new recommended budget. It says to restore funding for various IT personnel vacancies. So
Unless I can throw a lifeline, or Mr. Chairman, to the councilman, unless I can throw a lifeline to Mr. Merriman, I need to get you the number of folks represented by that, unless Mr. Merriman knows.
To the councilwoman through the chair, I don't have the specific number. We can get those, but those staff are housed in Jeff Mowry's office, and they support all of Health and Human Services, and so they have been centralized.
I think it's 8 people.
It is.
Yeah, vacancies.
8.
8.
8.
8 just for HHS? Okay. Thank you. And I don't want to beat a dead horse, but the centralized intake again. In my mind, if we're going through in strategic plans, and I think DCFS is, I know DSAS is, and I don't know about Employment and Family Services if they're done, there really should be discussions going on how we could centralize intake, because that's what's going to come out of the.
Mr. Chairman and Councilwoman Kamala, I very much hear your challenge to us, and we will go back and continue to look at that. I think the first important thing to do is probably what Tracy Mason and her colleagues have been able to do, which is to centralize intake even within their own organization, which is an important piece of that. Obviously, DCFS had the opportunity to do that some time ago. We also work very closely, as an example, and there's a contract through my office with 211, the support for United Way 211. They get a lot of calls that end up coming to us in some fashion. Janet Carr, my colleague, and I in my office were horrified when we saw the first iteration of the federal website on where do you call to get information on the implementation of the Affordable Care Act, and it had our little office number in it, where there's 2 or 3 of us to answer the phone. And so we quickly got that changed to the County Job and Family Services central number. Your point is very well taken about having sort of one number out there that folks in one centralized intake. We're going to have to work on those issues, because what happens after you get a call, depending on whether it's child welfare or adult protective service or a public assistance kind of call, are very different. And so I think we just have to make sure that, in fact, what we're doing is creating more efficiencies and creating more convenience for the folks calling us, or as instant as we can kind of help, but also do it in a way that doesn't slow down the back office function of actually getting that assistance out to folks. So but we'll very much take a look at that in 2014.
Can you send us, in getting that started, can you send us costs for all the centralized intakes for each department, what it's costing now?
Yes, ma'am.
And just to finish up, I just wanted to thank you for all your support and help with HHS levy.
Thank you very much.
You helped me out on some things, so thank you very much.
Thank you very much.
Councilman Schwan.
Thank you.
followed by Jones.
Thank you. You threw out the concept that consolidation and cooperation opportunities still exist and continue to exist. I can only think that is a place, following up with Mr. Brady, we probably learned a lot in these first 3 years as a council and learned our responsibilities. Probably one of the things we didn't do is we didn't do that same function, which was to consolidate the best of HHS needs and requirements with the best of business practices to get the most efficiency so that we start to throw off those gains that you're talking about. Lean practices in business are second nature. They've been that way for 15, 20 years. It's now time, I think, to do that in what we're talking about in Health and Human Services, because if we can throw off positive dollars, it just gives us the ability to use those for the delivery of services as opposed to the mechanical execution of getting ready to deliver those services. So you were the one who raised the issue, right. And my question would be, give me your biggest range from high end to low end of what you think that consolidation would be and in this area, because obviously historically, whatever that number is you're going to tell me is probably going to come up significantly lower than what historically is found when you start to do consolidation, lean, more efficient delivery, and bringing the best practices of business operations in conjunction with the need side of that. So I'll throw out, you raised it, and I'm going to walk right on in that door with you.
I'm not sorry that I raised it.
No, I'm not
Mr.
either.
Chairman and Councilman Schron.
It's where this dialogue needs to go.
No,
if we can consolidate our government in the form of a charter to consolidate into a more unified delivery service, we certainly can do that with the products that we deliver to our customers.
Mr. Chairman and Councilman Schron, I appreciate the question. Rather than throwing out some wild swag of an answer, I really would much prefer to go back and consult with people smarter than me about thinking through, first of all, to follow up on Councilman Connell's question, what is it currently costing us to maintain separate systems? I can't, and part of our challenge, and I know you've heard this from us before, but it is a challenge that we continue to have, is we are required to operate using systems that we don't create, and that we can't even change, state systems or federal systems generally. The ability for us to truly drive down costs of doing business are probably going to be contingent on us continuing to be able to advocate at the state and federal level. The county executive has helped us with that at the state level to get the state to relax some of its very hard-edged, barrier-filled or barrier-creating kinds of separations between their IT systems, which make us very difficult to do. I mean, I'm sure the high end of what we could save is well into the tens of millions of dollars if we could.
I have no doubt about that.
But I also don't know how much of that we have the ability to do on our own here. We can chip away at it, but I have a feeling we'd be on the lower end of the dollar saved by what we can do locally. Because frankly, if you think about it, all the money is in terms of savings in our public assistance agency, our child support agency, and the child welfare agency. And those three systems, which are our biggest systems in terms of their customers as well as their staff as well as the budgets, are all driven by a very old-fashioned centralized information system that we can't change. So we've got to work on that issue. I will say, though, and maybe this is a way of getting at your answer a little bit better, the work that I think we can begin to do within our smaller offices, where we are not oftentimes working with state, or in which we are not working with state-mandated systems, I think that will be a little bit of the canary in the mine shaft, or the early opportunity to look at some of those consolidations and some of those streamlining of systems. And so I'd love to take your challenge rather than the answer today, going forward and coming back to you with more of a nuanced.
I was actually
recommendation.
hoping that would be your answer, but because it'll force you to come up with a bigger range than what you would have come up with today, because you would have been very cautious of giving me that range.
So I'll say
the-
$10 for today.
Yeah,
but-
I knew that would be where we'd start. And I'll give you my number on the other end, and then we got the
okay.
range established,
Right.
right?
We'll meet
Yeah,
in the
all right. And the only thing I would ask you also is take the word can't out of your conversation
Okay.
and think about what if. What if that vision was using our charter form of government where we are using, and I think we're at the point where we should ask for forgiveness rather than permission on some of these items. And we take the vision and run with it and make it big, and then we'll let the other 88 counties or 87 counties copy us. So I throw that out only after, because I
Okay,
apologize,
then,
I have another
well,
meeting I have
appreciate
to go
that,
to.
Mr. Chairman and Councilman Schron. I think I'm too long a bureaucrat. I'll work on getting the can't out of my vocabulary. But thank you for the advice on this.
We'll get you, you're a business guy too, I can tell in the background.
Okay, Councilman Jones is next. We're still going to be here for a long time, so please come back.
Okay.
Yeah.
I'll tell my 3 o'clock meeting to be brief. Thanks. But I'm working on sexy county government.
Councilman Jones.
All right. Thank you, Mr. Chairman. Rick, I see you have advanced the pay for success process. Can you elaborate on where we are with pay for success?
Sure, I'd be happy to, but I will probably ask Mr. Merriman to give you the true skinny on that, because he's been the leader of that with the county, with the participation and the partnership of Mary Louise Madigan, who works in the Office of Health and Human Services with me. So David, do you want to give a quick summary?
I will be brief because I understand that there are other departments looking to go. We're to a point where we have identified a specific provider, and that provider has proposed an evidence-based intervention they feel would allow the county to either return children to parents quicker and into more stable environments, or not to take children when they think this intervention can support the family to address their issues. The range of numbers that we're talking about, they're pretty high. We think there's about 400 women in the homeless system over the past 3 years that have lost custody of their children. They don't lose it because they're homeless. We don't take custody of children because they're homeless. They've lost them because of the other conditions in their life that have probably also cost them to lose stability. And those 400 mothers account for about 700 children in custody. Those 700 children in custody cost us about $18 million. So we think that a portion of those mothers and their children could be served better, could be more efficient, and we could provide more stability. And what we're trying to do is we're actually reviewing those cases, and we're trying to determine how many of these families could we reunify quickly with additional support and give that family a better life than they had when they came into the system. What would it cost and what would it save us? And if we can establish all of that information, we would hope that we could get a funding partner to launch that program.
Okay. At one point, reentry was one of the targeted areas. Is that still the case, or are we?
To the councilman, to the chair, reentry isn't the direct focus. However, our Office of Reentry still does have an interest to explore pay for success. In fact, they have a grant that they've said they would look to do that. And one of the outcomes of this exploration is that we have signed a data sharing agreement with Case Western Reserve University. And for the first time, we have given Case the jail data and are asking them to match up jail data with homeless service and with child welfare data. And what we would like to assess is how much overlap occurs for these mothers. How many are at times in the homeless shelter, how many are times in the jail, and how many are times working with DCFS. So we feel that there's most likely a lot of cross-system issues. And if we address their conditions, we'll address all of the services that are provided to them.
Are there any dollar amounts at this point associated with what what we want to do with this?
We don't have a dollar amount at this time. I think we understand that the service that we could provide would, over a series of years would be in the millions of dollars, and the goal is to ensure that the savings would exceed the cost of the services for us to be able to provide a pay-for-success opportunity.
Okay, thank you. Well, Rick, I'd like to congratulate you as well on the HHS levy, and it was a pleasure working with you. And I'll say this, as we were working and we reached out to the ministerial groups, and as my colleagues mentioned earlier, in our overall strategy and reaching out with partners, we got a lot of support from the ministerial groups, and they were really able to penetrate the community. Also, a part of their conversation was we want to have a stronger partnership with the county. They felt that the partnership was not as strong as it could have been over the last 3 years, and I think that's going to be that's worth investigating and having a dialogue and conversation around what the churches can do. I feel that we have many community development institutions in the county, but I think when it comes to the human development we do, they are better fit than some of the other community development institutes. So I just want to throw that out there, and again, in the not too distant future, be a part of that conversation of how we can, again, think outside the box and look to see how we can partner in a way where they play an even stronger role in delivering service to the community.
Mr. Chairman, to Councilman Jones, after a couple of those meetings, I've had the chance to go out and meet with a couple of individual pastors, and I'd love I don't think we've done the job within Human Services that we should in terms of staying in touch with them. I think oftentimes we've consulted with lots of community organizations and faith-based organizations when we start something, but the challenge is to stay connected with them and communicating with them and partnering with them as things get more mature. And so I'd welcome the chance to work with you or any of your colleagues on continuing our outreach to that community.
And I'll just share with you just one example of what I've seen work in our food services, giving $1 million to the county food bank in the churches as they partner with the government in distributing the food for us. We don't have to spend that money and getting it into the hands of the community that needs it, a strong partnership. Churches sometimes don't even think about it in terms of, oh, this came from the county, or it's tax dollar provided from county. It came from the land bank. And sometimes just sharing that connection, realizing there's a partnership between the church and the state that's not politicized, just good service, and an area where the government and the church can work together on behalf of the community is one model that I think could be replicated. I would attend one of the food pantries in my district, and I found that just by me as a county elected official, being in that room, distributing food, I could actually talk to them and find that they had other issues other than just food. Right. And with that, I could direct them a phone number here, a phone number there, or just call 211 if we can't remember a phone number. And that was a way of breaking down the silos, just thinking not about just one issue, but multiple issues. And again, I throw all of that out to say I see those that is an example of a model that could be replicated across a lot of other areas of the human services world.
Agreed.
Okay. Thank you very much.
Mr. Chairman, I was wondering if I could ask if we could slightly shift around the remaining presentations and allow Robin Martin from the Family and Children First Council to go first in terms of the next presentation. She has a child care deadline to pick up her son by 4:30 or 5 o'clock. So could we allow her to go representing the Family and Children First Council first, and then we can take them in order from there?
Okay.
Would that be okay? Thank you very much.
Councilman Miller, to the chairman, if I may do one point of correction. So when I presented the list of budget recommendations and I referenced the Noxalone, I don't know if I'm saying that correctly, I said that's for treatment of heroin. That is in fact a overdose medication, so that when a person is in overdose, they're given this medication. So that's a misstatement on my part. Melissa Fetterman, who's here today for Rick's office, she's from the Center for Community Solutions, corrected me on it, and I wanted to correct the record. Thank you.
Okay. Ms. Martin,
Hi,
Family and Children First Council,
good afternoon.
welcome to the committee.
Thank you.
After Ms. Martin, we're going to have a short break.
How long do you intend to go? Because frankly, I mean, I think we're going to get information overload here. We've been here since like 9 o'clock. Are we going to go most past 4?
I think I don't know when else we can
Okay.
schedule. We'll talk during
Okay.
the break.
All right.
Okay.
I will be brief. I'll hit high points.
Okay.
Okay.
Good. Thank you.
Okay. Basically, our mandate is to respond to families who have a concern about system gaps or barriers, provide well-being services to all children, whether they are system involved or not, and provide programming for abuse and neglect prevention. So as you can see, I'm just going to hit some highlights over who we've served in 2012 and 2013. And please note that all the programs listed here represent 12 months, although some of them are on state calendar year and some are on county calendar year. So for out of school time, historically in our county, we have approximately 10,000 slots that are funded through voucher programs, 21st Century, or private pay by parents. In addition to those 10,000 slots, with the funding we receive from the HH levy, we have been able to increase the slots in Cuyahoga County by 33%. So that 5,019 slots represents that 33% of additional children who have a safe place to go after school and during the summer. 15,000 total for Cuyahoga County. But keep in mind, some of them are paid for by the levy, private pay, vouchers, and 21st Century. We have approximately 910 programs in Cuyahoga County, and they are mostly represented in the database that is managed by Starting Point. And of that list of programs, we've had 514 youth-serving providers receive some type of professional development through the funding provided for out-of-school time. And so that represents about 64% of the full providers across Cuyahoga County. They get some type of job enhancement training, an update on current curriculums that they're using with the kids, and further technical assistance for their IT programs. We've also begun a pilot program on some of the providers to do what we call, to do a program called the Youth Program Quality Assessment Evaluation. And what we're looking at is how the program views themselves in terms of their service delivery, but we're also asking their consumers, the kids, what they're receiving through the program. And we have a staff person from Starting Point that goes out and does an assessment. Based on the information we get from all three of those areas, it drives the professional development training that we're offering countywide, which is offered to all programs regardless of whether or not they receive funding. I'm going to skip down on the list and talk about our youth engagement activities. We have a very extensive youth engagement model in our county through our Youth Advocacy and Leadership Coalition. They did a name change this year. You all may have formerly known them as the YAC or the Youth Advocacy Committee. Through that group, they have been able to offer youth advocacy, youth voice at a state and national level, participating on roundtables at the state that look at youth voice as we move forward with developing programs across the state, but also from a national perspective of what's happening to our young people in their communities. They provide training to other youth in the community on financial literacy and healthy living. Through their financial literacy program, they bring young people in and they give them a job. So they get a slip and they have a job, and on the job they're told what their annual salary is. and then they go around to various stations and experience things in life that we experience as adults, and they have to figure out from a financial standpoint, how are they going to manage those issues in an effort to teach them financial literacy. Each year, they host an event asking other youth to come to the table. They recently had an event last Saturday where they were able to reach out to youth from 29 communities across Cuyahoga County, and that included 4 contiguous counties. We had some kids come in from other counties, and they collaborated with 16 other youth organizations to have a full day of conversation about what are our youth facing. I want to add one item that I hadn't planned to talk about, but I do want to talk about because we've had a lot of conversation today around collaboration. You noticed on the list, I think about the 6th or 7th point down, this year we had service coordination for 132 youth. And in service coordination, all of the child-serving public systems have identified a person in their organization who comes together to do some type of cross-system case planning for kids that are experiencing a crisis that no one system could handle on their own. Through this collaborative group, they were able to divert 104 kids out of that population, which represents 79% from out-of-home placement, and keep those kids in the community receiving wraparound services in their home with their family. And that the average cost on the kids that went to placement, because they're in short-term placements that are monitored very closely, is about $17,290.88. So what are we looking at for 2014? In 2014, we want to look at some service gaps we identify in out-of-school time. Last year, 2012, we went countywide with out-of-school time, offering an opportunity for out-of-school time providers across Cuyahoga County to apply for an out-of-school time grant. When we looked at the initial group of providers for last year, we were able to identify some specific service populations that are not being represented in the original contracts. So for example, we have a huge youth Hispanic population on the Near West Side that are not receiving services, so we want to go back and close that gap. So we want to spend 2014 closing some of our service gaps. We also want to look at, we've been working very closely with local school districts, the Education Service Center, and the early childhood community, specifically Invest in Children, looking at how that handoff happens between early childhood, which is Invest in Children's office, and our office, which is youth development. So how are we transitioning kids from their last year of preschool over into kindergarten, where our office picks them up and monitors them going forward? So through that process, we're looking at the services we're providing. We're looking at the whole promotion around kindergarten readiness and early registration. And we're also looking at, as in the past, we had multiple kits. So we were looking at a preschool kit, we had a kindergarten kit, we were gonna do a first grade kit. Well, we're not gonna do that. We're gonna do one school readiness kit, one transitions kit. And it's going to look at what our young people our little young people are receiving that last year preschool, what the parents and the kids need for kindergarten, but we also have been are going to work with Mr. Merriman around the college scholarship program. So we want to make all of it one kit where it's a one-stop shop for our parents. For service coordination, we're looking at a database to track families that come into service coordination. Our current database died, and so we will look at a database, but within our existing budget. And we want to track all of the touch points for families that contact our office or contact those system representatives to receive those cross-system services. We're also looking at, and there's no cost to this, a new service coordination model. It doesn't replace the old model, but what we found is that the existing model is very taxed, because we have a lot of kids that are coming to the table that really do not meet the criteria. And so we have been working with juvenile court and the Department of Children and Family Services to identify the profiles for the three types of families and youth that we're looking at. And we are going to work to implement a new model that specifically addresses those three populations. So those populations are kids that were formally presenting to the court on what we call an intent to grant custody, children that were presented by their families for an unruly filing, or children that are part of the Department of Children and Family Services and juvenile court looking at cross their shared cases. We call them crossover cases. Our role in that process is to bring other stakeholders to the table to help support the Department of Children and Family Services and juvenile court to make sure that they are successful as they try to work those specific types of caseloads. We're also looking at internships, and this contract actually is starting this year but carrying over into 2014. We're looking at 125 youth across Cuyahoga County. At first glance, it looks like a youth employment program, but it is not. It is an internship for 11th and 12th graders who have identified a career path. And what our young people said when we met with them in some of the focus groups is the only time they get to see professionals is if they're going to the doctor, in school, if they're involved with the Department of Children and Family Services or juvenile court. They don't get to see an architect. They may not get to see an accountant. But those are some career paths that they're interested in. So we want to give young people that have those ideas an opportunity to match them with an employer to actually do an internship in those areas. And we're really focused on trying to provide a program like that before they go to college and pay for 4 years of college, only to find out that that is not the field they're really interested in. And then lastly, we want to expand the Families and Schools Together program. The Families and Schools Together program is designed to reduce public system involvement with families by developing a stronger support system for families. And it also promotes parental involvement in their child's education by building a stronger connection with their local school, so where their children are during the day.
Okay.
I have to do that fast.
Okay. Questions? Ms. Conwell.
Thank you. To the chair, to the director. We're going back to the recommended budget that was given to us this morning under Family and Children First Council. It's to restore funding. It was stated that it was going to restore funding in every area that was taken out. But so I just want to be clear, because the budget book states, and we'll go through them, each of them, workforce development, youth employment, 200,000 was the original deduction, but the restored funding is just 100,000. So I just want to make sure that's a typographical error, or is that?
I'm sorry, I'm not following. Could you repeat that?
Well, in the budget, in the original budget, when you targeted budgeted reductions, you said the workforce development, youth employment would be reduced by $200,000. But when we were given the recommended budget this morning, it was stated that everything was restored to its natural, original place, but your new recommended budget states that you're only going to restore funding to youth employment 100,000. So I just want to make sure that it will be restored fully to the 200,000.
Actually, David, I can respond to that.
Okay.
To the councilwoman. When we received our original budget from the Office of Budget and Management, the placeholders where they had placed some of our funding was not consistent with the direction of the council. Okay. And so we sat down with them to reorganize our budget. So the dollars that you see printed on this sheet are from the original listing.
Which sheet are we talking about, the original budget plan or the new sheet?
This sheet
Okay.
is from the original numbers that OBM gave us. What you have in the budget book is our recommended changes within our existing budget. So if they restore the $784,004, it does actually bring us back to what you see in the in that other listing with different dollar amounts.
So you'll be put back to the 200,000?
Yes, we will be whole.
Okay. And under the sex awareness portion from the Board of Health,
Yes,
on the sheet that we got today, it's actually an increase, 432K, but it was previously 373.
correct.
So it's, because it's the reverse, actually. It's actually the increase on this sheet,
Right.
but
The sexual awareness program used to be a collaboration of the county and several philanthropic partners. Over the last 4 years, the philanthropic partners have pulled out, and one of the decreases is resulted in our inability to continue the evaluation component. So the funding that was pulled out of that contract went to evaluation. So that's kind of like that shift in dollars, went over to evaluation to keep the evaluation going.
but this actually states, in the new recommended budget, is actually an increase.
Right, and what I'm saying is that these numbers are incorrect because we did a shift that's not consistent with this.
So you'll send us the new numbers?
Yes,
Okay.
Yes.
So it's no need to, and I'm sure that's the same with the youth advisory, that lost to $5,000.
Yes.
As well as the evaluation, like you stated, went up to 100K instead of 50K.
yes,
And we were told earlier that the Ohio State Extension was added back to the HHS instead of out of the general fund. But
that's
you-
separate
Okay.
from us. That's separate. Now, them being in the general fund or HHS is a contract that, based on their rules through Ohio State, they had absent of this. The reason they are the lead agency for the Youth Advisory and Leadership Coalition is because they responded to and won an RFP that our office put out for a youth advocacy lead agency. So the two are separate.
Okay. So you could send us that. I mean, I just wanted to make sure that you're aware of these, these inconsistencies in numbers, because when we look at the budget, we're just going to go with basically this last sheet, that those are the amounts that are being restored.
I'll send the corrections.
Thank you.
Any other questions? Okay,
Thank you.
thank you very much. Director Merriman, if any corrections on the sheet are identified, would you review those carefully with the agencies and get us a new report as soon as possible?
Absolutely.
Okay. Time for a break? We're going to break for just about, 5 or 7 minutes till 20 past the hour. Thank you.